Welcome to the Learning Center. Today we're going to be going over disability etiquette. Blind, a condition where central visual acuity does not exceed 20 or 200 in the better eye with correcting lenses, or where visual acuity, if better than 20 or 200, is accompanied by a limit to the field of vision in the better eye to such a degree that its widest diameter subtends an angle no greater than 20 degrees. Severe disability, a severe physical or mental impairment, a residual limiting condition resulting from an injury, disease, or congenital defect that so limits the person's functional capabilities, such as mobility, communication, self-care, self-direction, work tolerance, or work skills, that the individual is unable to engage in normal competitive employment over an extended period of time. Capability for normal competitive employment shall be determined from information developed by an ongoing evaluation program, conducted by or for the nonprofit agency, and shall include as a minimum a pre-admission evaluation and a re-evaluation at least annually of each individual's capability for normal competitive employment. A person with a severe mental or physical impairment who is able to engage in normal competitive employment because the impairment has not been overcome or the condition has been substantially corrected is not other severely handicapped within the meaning of the definition. Hearing disability, hard of hearing, and deaf are not the same. Hearing disability refers to both persons who are hard of hearing and persons who are deaf. Deaf people utilize their vision skills for communication. Hard of hearing persons seek ways to retain their listening and speaking skills. It is okay to use the terms the deaf or deaf person. This is an exception to the person first language rule. There is a wide range of hearing loss and communication methods if you do not know the individual's preferred communication method, ASK. To get the attention of a person with a hearing loss, call his or her name. If there is no response, you can lightly touch him or her on the arm or shoulder, or wave your hand. When using an interpreter, always address your comments, questions, and concerns directly to the person with whom you are talking to, never to the interpreter. Always face the individual and not the interpreter. Always look directly at the person who has hearing loss. Use eye-to-eye contact. Use facial expressions and body language to communicate the emotion of a message, such as displeasure or approval. Watch the individual's eyes to ensure understanding. Do not depend on affirmative head nodding only. If possible, use email to communicate. Tips for texting. Make your communication clear, simple, and concise. Typical abbreviations. GA, go ahead, means that the person has finished their statement, the other person can start typing. Q, use instead of a question mark. SK, this means you want to conclude your conversation. When you read SK, type SK if you are completely finished talking. Can the person read lips? Not all people who are deaf can read lips. Speak clearly, slowly, and expressively to determine if the person can read your lips. Do not exaggerate your speech. People who read lips only understand 20 to 25% of what is being said. Be sensitive to the needs of people who lip read by facing the light source and keeping hands, cigarettes, and food away from your mouth when speaking. If you are asked to repeat yourself several times, try rephrasing your sentence. When providing information that involves a number or an address, consider alternative ways to provide it. Writing, faxing, or emailing are great ways to ensure accuracy and decrease frustration. Have a pencil and paper available and use them if necessary. If you are experiencing extreme difficulty communicating orally, ask if you can write. Never say, "Oh, forget it, it's not important." Keep messages simple and direct. Be aware of the environment. Large crowded rooms and hallways can be very difficult for hearing impaired persons. Bright sunlight and shadows are also present barriers. In group settings, let the deaf individual determine the best seating arrangement in order for them to see the speaker and interpreter. Watch for signals that the deaf individual wishes to contribute. Ensure that one person speaks at a time. Do not pace while giving a presentation. Do not talk with your back to the audience while writing on a flip chart or blackboard. Incorporate visual aids, demonstrations, flip charts, written agendas, and handouts in presentations. Do not change the topic of conversation without warning. Use transitional phrases such as "okay, we need to discuss." People with intellectual disabilities are not eternal children. Adults with intellectual disabilities should be treated and spoken to in the same fashion as other adults. Do not talk down to a person with an intellectual disability. Assume that an adult with an intellectual disability has had the same experiences as any other adult. Like everyone else, people with intellectual disabilities are extremely diverse in their capabilities and interests. Avoid stereotypes, such as the assumption that all people with intellectual disabilities enjoy doing jobs that are repetitive or want to work in fast food restaurants or supermarkets. Many people with intellectual disabilities can read and write. Don't assume that a person with intellectual disability lacks academic skills, such as reading, writing, and the ability to do mathematics. While an individual's disability may significantly impact these areas, many people with intellectual disabilities have at least some level of these academic skills. Even if people's academic skills are limited, they still have much to share and contribute. A low level of academic skills does not mean that people don't have valuable ideas and thoughts. Provide opportunities for people with limited academic skills to contribute verbally and to take what they have to say seriously. Ensure that people who have difficulties reading or writing have equal access to written materials. Use pictures or simple photographs to identify rooms, tasks, or directions. Treat the individual as you would anyone else. If engaging in a conversation with someone with an intellectual disability, bring up the same topics of conversation as you would with anyone else, such as weekend activities, vacation plans, the weather, or recent events. People with intellectual disabilities can understand directions if they take their time and are patient. Use clear language that is concise and to the point. When giving instructions, proceed slowly and ask the person to summarize the information to ensure that it has been understood. You may have to repeat yourself several times in order for the individual to take all the information. Walk through the steps of a task or project. Let an individual perform each part of the task after you explain it. Don't defer to a staff person or caregiver. When a person with an intellectual disability is accompanied by another person, such as a staff person, caregiver, or family member, don't direct questions and comments to them. Speak directly to the person with the intellectual disability. Also, don't allow someone else to speak for the person with the disability. Avoid the term mental retardation. If you need to speak about a person's disability, people with intellectual disabilities prefer the term developmental disability rather than mental retardation. The terms mental illness and psychiatric disability are essentially interchangeable. Some groups and individuals prefer one term to the other, but in general, both terms are considered acceptable. A possible alternative is to describe a person as someone who has mental health issues. Do not assume that people with psychiatric disabilities are more likely to be violent than people without psychiatric disabilities. This is a myth. The wide range of behaviors associated with mental illness varies from passivity to disruptiveness. When the illness is active, the individual may or may not be at risk of harming him or herself or others. People with mental illness do not have mental retardation. However, some people who have mental retardation also have a mental illness. Do not assume that people with psychiatric disabilities also have cognitive disabilities or are less intelligent than the general population. Many people with mental illness have above average intelligence. Do not assume that people with psychiatric disabilities necessarily need any extra assistance or different treatment. Treat people with psychiatric disabilities as individuals. Do not make assumptions based on experiences you have had with other people with psychiatric disabilities. Do not assume that all people with psychiatric disabilities take or should take medication. Do not assume that people with psychiatric disabilities are not capable of working in a wide variety of jobs that require a wide range of skills and abilities. Do not assume that people with psychiatric disabilities do not know what is best for them or have poor judgment. If someone with a psychiatric disability gets upset, ask calmly if there is anything you can do to help, and then respect their wishes. Do not assume that a person with a psychiatric disability is unable to cope with stress. My chair, my body. Wheelchairs are not footstools, step ladders, or fire hazards. People who use a wheelchair, walker, or cane often consider this technology to be an extension of their body. They are part of an individual's personal space and should be treated with the same dignity and respect. Do not lean on them, push them, or move them without explicit permission. Talk face to face. If an individual uses a wheelchair, sit down or position yourself at the same eye contact level. Always ask if you can offer assistance before you provide assistance. If your offer is accepted, ask for instructions and follow them. When given permission to push a wheelchair, push slowly at first. Wheelchairs can pick up momentum quickly. Personally check locations of events for accessibility. If barriers cannot be removed, alert persons with mobility impairments before the event so that they can make decisions and plan ahead. Do not ask people how they acquired their disability, how they feel about it, or any other personal questions unless it is clear that they want to discuss it. It is not their job to educate you. It is considered patronizing to pat an individual who uses a wheelchair on the back or on the head. Remember that, in general, persons with mobility impairments are not deaf, visually impaired, or cognitively impaired. The only accommodations that you need to make are those that relate to mobility impairment. Take your time, relax, and listen. With a little time and patience, you can comfortably converse with a person who has a communication disability. Don't try to rush the conversation or second guess what a person has to say. Plan for a conversation with a person with impaired speech to take longer. It's okay to say, "I don't understand." Solicit and provide feedback. If necessary, repeat your understanding of the message in order to clarify or confirm what the person said. Do not ignore a person with a speech impairment because of your concern that you will not understand them. Do not pretend you understand what is being said if you do not. Instead, repeat what you have understood and allow the person to respond. The response will clue you in and guide your understanding. Do not interrupt a person with a speech impairment. Be patient and wait for the person to finish, rather than correcting or speaking for the person. If necessary, ask short questions that can be answered with a few words, a nod, or shake of the head. Face the individual and maintain eye contact. Give the conversation your full attention. If the individual is accompanied by another individual, do not address questions, comments, or concerns to the companion. Do not assume that a person with a speech impairment is incapable of understanding you. Some people with speech impairments have difficulty with inflections. Do not make assumptions based on facial expressions or vocal inflections unless you know the individual very well. Do not play with or try to use someone's communication device. Such aids are considered an extension of an individual's personal space and should be respected as such. If you are having trouble communicating, ask if an individual can write the message or use a computer or TTY. Blind doesn't mean blind. Having a vision disability does not necessarily mean that a person lives in total darkness. Saying hello and goodbye. Don't assume that people with vision disabilities will remember your voice. It is considered rude to ask a person with a visual disability Do you remember my voice? Identify yourself by name when you approach a person with a vision disability, and tell them when you are leaving the conversation or area. Communication. Use a normal tone of voice. For some reason, people with vision disabilities are often shouted at. It is okay to use vision references such as see or look. Orientation. It is considered polite to indicate your position with a light tap on the shoulder or hand. However, keep your physical contact reserved. Give a person with visual impairment a brief description of the surroundings. For example, there is a table in the middle of the room, about 6 feet in front of you, or there is a coffee table on the left side of the door as you enter. Use descriptive phrases that relate to sound, smell, and distance when guiding a visually impaired person. Mobility assistance. Offer the use of your arm. If your assistance is accepted, the best practice is to offer your elbow and allow the person with the vision disability to direct you. Don't grab, propel, or attempt to lead the person. Do not clutch the person's arm or steer the individual. Walk as you normally would. Do not be offended if your offer to assist a visually impaired person is declined. Service animals. Guide dogs are working animals and should not be treated as pets. Do not give the dog instructions, play with, or touch it without the permission of its owner. Avoid cliched phrases such as the blind leading the blind. What are you, blind? I'm not blind, you know. Do not grab or try to steer the cane of a person with visual impairments. Always determine the format in which a person with visual impairments wants information. The usual formats are Braille, large print, audio tape, or computer disc or electronic text. Do not assume what format an individual uses or prefers. Direct your comments, questions, or concerns to the person with a visual impairment, not to his or her companion. If you are reading for a person with a visual impairment, first describe the information to be read. Use a normal speaking voice. And do not skip information unless requested to do so. Thank you for joining us on this Learning Center presentation.